All right. Thank you, everyone, for joining us. Logan, Tezem, thank you for taking your time to be here with us and really talk to us about your expertise. And just to give a brief introduction to myself, give a brief introduction to everyone before we pass the back off to Andrea. My name is Joshua Dumas. My full-time job is Center Director for ChenMed, or Dedicated Senior Medical Center. I am based regionally in North Carolina and have the pleasure to support our North Carolina, South Carolina, Georgia, and Tennessee markets. And have the pleasure to really spend a lot of my free time, my time that I spent working on my passions, with the Advancement League and thinking about, how we as an organization can address housing, right? What a broad and widely spoken about topic. And we have an amazing opportunity to learn from two folks that are, in the weeds, on the ground, doing this work in two very different ways. And we love to, really kick off 2023, thinking about housing and how important this topic is and what the work that's currently being done and, hey, what's not finished yet, what work that still needs to be done. But before I hand off, I'm going to read the bios of our two amazing guests before we hand the ball off. I did want to see if Andrea wanted to introduce us, because I definitely got excited about our guest here and wanted to give her an opportunity to kind of kick this whole thing off.
No worries. Love the enthusiasm. Thank you, Josh. So Andrea Swan, I am the head of community impact, and I just wanted to welcome you all for our first impact forum of the year. You can look forward to see one of these on a quarterly basis where we will cover a new topic of interest. And so the format that we're going to follow today is, as Josh mentioned, great panel discussion with these two, and then followed by an opportunity for a question and answer from the audience, be it on any of the topics that they covered today, as well as, closing out with the opportunity to share just any sort of comments, questions, concerns, ideas, opportunities for the future around all things community and impact. So looking forward to the conversation, and I can't wait to see your engagement. Thank you. Take it away, Josh.
Absolutely. Thank you. So just to introduce our amazing guests, starting with Tezem. Tezem is an urban strategist, community convener, and impact investor. He uses finance, real estate development, social services, and policy to provide and improve several professional lives. Tezem has worked as an investment. There we go. I think Tezem has worked as an investment advisor, real estate developer, financial services writer, and managing director of social services programs in the mental health, homeless, formerly incarcerated, and social justice disciplines. His most recent work centered around demonstrating the economic and social benefits of the arts and artists within communities so that public and private entities increase investments that make sense from a quadruple bottom line lens: people, planet, profit, and purpose. I love it. An Oakland native, Tezem grew up in the city's Diamond District, a neighborhood he credits with helping to shape his worldview and belief that diversity is a necessary component for creating resilient communities. Just as ecosystems are strengthened by biodiversity, neighborhoods and companies are more resilient when people of different backgrounds come together. He believes that proximity and access to public spaces, academic and cultural institutions, and public transit are the bedrock of inclusive, diverse, safe, and healthy blocks, neighborhoods, and cities. Adaptive reuse, infill development, green infrastructure, and public art are primarily his current tools of choice. At SHCLA, his work focuses on demonstrating on how to access to high opportunity neighborhood. Biophilic design and mixed income housing can improve resident outcomes in the adult residential facility or the adult residential facility for the elderly space. Tezem received his BA from Indiana University in Bloomington and his JD from the Paul M. Herbert Law Center at the Louisiana State University. Logan McDonald has dedicated his life to serving the community, mentoring at-risk youth, volunteering on multiple nonprofit boards, and connecting with philanthropists to garner donations needed to prevent homelessness. This need for service comes from growing up and seeing how equity gaps can lead to so many different issues surrounding health, socioeconomic opportunity, the criminal justice system, and housing. And one of his greatest achievements was to have been a part of an amazing team that brought mobile showers to a community where the individuals experiencing homelessness were not getting their basic needs met. Additionally, he's overseen multiple housing, behavioral health, employment programs, providing vital support and services to those that are experiencing homelessness. Logan hails from the other side of the country in New York City, suburbs of Westchester County, and is now proud resident of Oakland, California. He's a graduate of Florida A&M University, where he majored in criminal justice, minored in social work, and is a member of the Alpha Phi Alpha Fraternity Incorporated. He currently serves as the executive director of Keep Oakland Housed, an initiative to prevent homelessness and fight displacement for the precariously housed. Teslim, Logan, welcome. Thank you for joining us in this conversation and really, getting the ball rolling. I think kind of setting the stage with housing, right? Setting the stage was really defining housing. I remember when we first had our initial conversations, it was, housing is such a broad term, right? And when for some reason, when we think homelessness, we think of the folks that are maybe sleeping in tents on the street, and we think about the folks that are at the absolute bottom floor. But can you kind of just start the ball off, whether one or both of you, just giving your perspective on like what the full spectrum of housing insecurity can actually look like and what that reality truly is?
I could kick it off. So, when I think about housing security, that really just means at risk of eviction, at risk of displacement, at risk of homelessness. It means being uncomfortable, unsafe. And the truth of the matter is, I think that term can differ based on culture. There are some cultures where many different generations live in a household. There are some cultures where that would be seen as like couch surfing, or like being in between apartments. So I really do think that there's a cultural aspect, and depending on who you're talking to, you'll get a different definition.
Logan, I'm really happy that you brought that up, because I feel like that's something that's rarely talked about in the space, the difference culturally. I think that, with housing, I think, Josh, you talked about kind of the broad and expansive nature of housing and, different definitions. I think, technically we try to keep housing at 30% of one's income. And if it rises above that, it is technically unaffordable. But in the Bay Area, many working professionals pay upwards of 30%, most of the time closer to 50% of their income on housing. And so housing insecurity is something that affects many in high cost parts of the country. In the Bay Area, it's something that most can identify with. Particularly for the residents that we serve, extremely low income individuals who are on fixed incomes most of the time, Social Security, disability benefits. We're talking about roughly about $1,000 a month, and at 30% of one's income would be about $300 a month. And to find a unit or even a shared room in the Bay Area at that level is very difficult. So housing insecurity is very rampant across high cost areas like Alameda County.
That's a really fair point. I had the opportunity to spend about 2 years in Oakland and the Bay Area and really see, this issue in person, right? When you think Bay Area, you hear about how big of a problem this is. But for those that haven't had a chance to actually come to Alameda County or San Francisco County or anywhere near Northern California where this is perpetuated, where you are housed, can you kind of paint that picture of what it looks like? And you mentioned, most people are in unaffordable housing, or, everything seems to be over that 30% of your income threshold. Can we kind of paint that picture of what it looks like in the Bay Area for folks to maybe have trouble conceptualizing?
Yeah, I can maybe start. So, the Bay Area has, a history that I think has been documented in several books and papers. There's, The Color of Law by Richard Rothstein that goes into some of the history of redlining, even in the Bay Area, which is surprising to some individuals, just given the progressive nature of the Bay Area. I think that that history does present itself in the current housing landscape. Is in terms of homelessness, 40% or 47% of the homeless population in Alameda County is African American. And when you think about the down payment divide, the difficulty of African American and POC communities to access down payment assistance, there is this, just general access question that is a burden on communities of color. The homeless population, I think, in the county is connected to the high cost of housing. There are limited public resources. We in the housing world talk about the end of redevelopment and what that meant for local jurisdictions to produce affordable housing. There are some one-time sources that are becoming available now under the state, community care expansion and behavioral health, funds from the state that are providing opportunities for the production of permanent supportive housing for individuals with mental health issues. We're hopeful that these one-time sources become recurring sources of funds to pull from for affordable housing developers and those providing services to that population. But I think it's always so much of our work is connected to the flows of public funds, and always looking for opportunities for the community to be more involved and engaged in some of the housing work.
Yeah, that's you pretty much covered it. But if I could add anything, I'll just say, to his point earlier, like Oakland, for example, was the Black Mecca of the West, and in the past 20 years, Oakland's also lost 30% of its African American population. And that's largely due to the increased rents, the weak rental protections, and really just predatory landlords, if I could call it out.
That's an interesting. Before we kind of dive into the specificities that like your own domains are working in to address this, Tazim, you mentioned like the increasing cost of living that is prevalent in the Bay Area. I live there. I remember paying $5 a gallon for gas, and I wanted to cry, right? And that was just more. And you're mentioning, Logan, a good chunk of the African American population that's from the Black Mecca of the world, right? They're leaving, right? And I'm sure there's a correlation between those two things that I just mentioned. But we're thinking about, these are larger cities where we're seeing a lot of this issue prevalent. When we're talking about gentrification and organizations are trying to bring value into these cities, but who is put at the disadvantage when we're bringing a lot of these values and raising the value of a lot of these things. And maybe the tech companies, or maybe there are folks winning, but on the other end, what's happening, right? And it's an important thing to kind of call out. And I kind of wanted to just, before we moved on to the what it is like specifically we're doing, but to that piece of gentrification, right? And do you guys have any thoughts, or one of you have any thoughts on how does that perpetuate this problem, especially in larger cities where people are flooding to the city, but then who's being forced to leave? And how does that kind of perpetuate this problem of housing insecurity?
I guess some could argue that is the problem of housing insecurity. I think that, I'm a New York native. I'm sure that, me coming out here, being displaced from New York and then leaving, getting an education, coming out here, diving into work, it's like I could be part of the problem, depending on who you're asking. I think that a lot of us are part of this greater ecosystem. I will say that a lot of it has to do with just supply and demand too. There's a lot of housing that hasn't been built that should have been built. There's a lot of land preservation that's happened in the Bay Area that is inherently racist and contributes to, again, just rising. The stock is low. one example or just one idea that people talk about, at least recently, is they compare it to this idea of musical chairs. They say, just imagine you're playing a game of musical chairs. We already know there's less chairs than the people that are playing, right? That's how it works. So what happens is the person, imagine a kid that has a broken ankle, right? And then that's the kid that doesn't get to the chair. Now, some could say he didn't get to the chair because, you know, he had the broken ankle, but some could say that he didn't get to the chair because there weren't enough chairs, right? I think another aspect of that is also just the fact that, you know, even if you were to keep creating housing without actually addressing some of the other issues, one could say that, you know, increasing the water in the faucet doesn't make the drain any smaller. So we have to have these, we have to be cognizant of what we're doing, why we're doing it, and actually address the need.
I love it. Thank you, Logan. You said a nugget there about the drain and increasing the flow from the faucet does not change the size of that drain, and I love it. I will be using that analogy. But those specificities, like kind of like just shifting forward, right? You both are doing amazing work related to housing security, but on probably polar opposite ends of the spectrum. You know, your bio doesn't do enough justice to speak to the great work that you guys are doing. Tez, I'm starting with you. Would you mind kind of giving us a view into your world and the work that you are doing? You know, where in the spectrum of housing insecurity or addressing homelessness does that work lie, and what does that work look like on a day-to-day basis?
Yeah. Let's see. I think, you know, trying to clarify the housing continuum is always a work in progress. But I think, you know, at one end of the spectrum, there's I think we realize that there's an understanding of shelters and transitional housing. I think just more generally in the public domain. You know, at the other end of the spectrum is permanent supportive housing or affordable housing projects that people see, often large multifamily buildings with, you know, 100 units plus. But, you know, there's this other segment of the housing continuum closer to shelters and transitional housing, but really connected to the healthcare system, which is the adult residential facilities or residential care facilities for the elderly. These are commonly known as boarding care homes, and they're licensed by the state of California. And they provide non-medical care and support to individuals with providing access to and assistance with activities of daily living, like grooming, bathing, and you know, providing 3 meals to individuals per day. And you know, the reason we were started really with this idea that housing could be an intervention similar to a prescription, that you know, you could provide housing and allow an individual who is suffering from severe mental health impairments access housing that would stabilize them. If they were ever hospitalized, there would be a safe place for them to come back to. And so, you know, we were funded by the state's Mental Health Services Act, an innovation fund from the state that really wanted to take a new look at housing this population, and wanted to see if a community land trust could be the first of its kind in the nation created to address this issue. And so we've been working over the last almost 2 years now to, you know, startup mode for a new organization, you know, infrastructure, office space, you know, building out our financial models for some of the acquisitions, and really working with community partners and potential residents to ensure that we have the kind of information we need to ensure that we're providing the types of housing that people want to see. And so really working in this space of licensed boarding care facilities. And also the other piece of our work is a family co-investment model. And so This is, also, I think, an innovative piece of our work that really looks at family members who have some resources saved that, want to put that together with other families who would purchase a building together in partnership with a community land trust, ensuring long-term permanent affordability and really ensuring that loved one has a safe place if something were to ever happen to them. And so this combination of both models with our great partners at Alameda County, we've been able to really build out that infrastructure, and now are in the process of working closely with both boarding care operators and also families at acquisitions throughout Alameda County.
No, that was amazing. I love the innovative nature of the work that you guys are doing, and just how you guys are hitting the ground running and providing as much support as you possibly can on that, almost on the latter end, after you've experienced this insecurity, and after this is, here's the work that we can do. Right. And here's the support that we can, whether it's for you directly, even with your family. Right. And I love how you're tying the family back in and kind of giving them some ownership. Right. That ownership of caring for their loved ones as well. Now I'm kind of bringing it to the other side. Right. Down the other side of the continuum. Logan, talk to us a little about your world and what that looks like on a day-to-day basis.
Yeah, definitely. So I work in homelessness prevention. And what that means is that we want to stop homelessness before it even starts, right? And we're all whole human beings, right, with different lifestyles, but there could be so many different reasons why someone find themselves in a precarious living situation. It could have been a roommate that moved out abruptly. It could have been a job loss. It could have been a breakup. It could have been so many different things that left someone in a position to find themselves with an eviction notice. So what we try to do is get a better understanding of this multifaceted kind of approach of how we can address it. So if someone owes back rent for the past couple months because they had to take care of, say, they had a kid in school that was doing remote learning and they had to choose between a laptop and their rent, right? It's like, okay, we understand why you made that choice, but what can we do to get you back whole? So we could help with the back rent, or it could be ongoing rent. Let's say we talked about rent burdens earlier. If someone has a rent burden of 75%, that would mean that their income was $2,000 and their rent was, let's say, $1,500. That gives a 75% rent burden. What do we do to bring that down to 50%? So that would be a shallow subsidy that we could provide for a few months. And during that time, while we're getting you back to a 50% rent burden, we could help you with either increasing your income or decreasing your expenses. We could connect you to employment support. We could connect you to other resources. Sometimes it's about thinking outside the box. Would covering your rent for the next 6 months help? Or maybe would buying you this car so you get to your job that you weren't able to get to and you might lose for $2,000. Would that be a better approach? So one thing is, since we started in 2018, that was kind of the model. I think for the past few years, we've been focusing on COVID response. So we actually ended up funneling $40 million back into the city of Oakland. And now we're at the point where it's like, okay, the pandemic's coming to a close, but people are still hurting. So what do we do? And we have to think about what we can do with a more finite amount of resources. We don't have $40 million anymore, but we do have some money and we do have creativity, and those are the things that we harness so we could funnel that back into the community and best serve for sustainable housing.
No, that is incredible, right? So on the prevention end, you're pulling out all the stops to say, look, here, you guys have identified all these different almost leading indicators to homelessness, and say, hey, before you even get to that point, let's see if there's something that we can do for you. Just a final question. I'm wondering, do you find them or do they find you?
I love that you asked that question. So we are fully accessible. People could come to our website. We're opening it back up in a couple of months. However, we understand that there is a digital equity gap. We understand that not everybody has laptops. So we went to the most highly impacted zip codes, and we found nonprofits that are super grassroots nonprofits that have been historically excluded from funding. Some of these nonprofits may not even have budgets, right? But and the people look like us that lead them, but we're partnering with them, we're funding staff members over there So we can actually have people in the highly impacted communities. We can support nonprofits that weren't always at the table. And what we can do is not just support them, but be in those communities, brick and mortar wise, so people can come see us. Secondly, we're also looking at other ways to create access, whereas even if it's not on a computer, even if it's not in your neighborhood, what does it look like to even have like Twilio, text, it's like text help to this number, so we could come meet you where you are. Maybe we might do a home visit. So there's a lot of different things that we're thinking about to create access, because that's what our North Star is.
That I think it is absolutely incredible that, both of your organizations seem to be relatively newer, relatively smaller, but still out there making extremely impactful work in your community from very different lenses, right? But across industries, we see whether it's like massive, large corporations, whether it's Kaiser Permanente making huge commitments to addressing housing insecurity, or CVS doing the same thing, or a lot of we're seeing how much we're seeing entire conferences around housing. We're seeing so many conversations are happening around here in terms of we need to fix this problem. We're hearing about the work that's being done in the prevention end. We're even hearing work that's being done on the, okay, let's get you out of your homelessness and let's get you in a supportive environment. What's missing? Where's this? So we just talked about one end of the spectrum, we talked about the other end of the spectrum, but there's this whole area in the middle that seems to be missing. Can you talk to me a little bit, what in your mind, what comes to the top of your mind when you're hearing about to filling that gap?
That's that's a tough one. I think as we think about homelessness and the related housing issues, that access to capital is always a huge thing. And I hate to say it's just money. I don't think it's just money. I think that there's the average cost of a new unit of permanent supportive housing is in the 600 to 700,000 range, and so we need billions of dollars in Alameda County alone to address some of the housing issues. But at a deeper level, I think the importance of organizations that are doing this work in close partnership with communities is the importance of collaboration, right? The importance of actual shared decision making. Community land trusts are by their nature, split into thirds with public representatives, community members, and residents or family members. And so there is this ability for individuals to always provide feedback and collaboration. I think that ability to have access to some of the levers of power is an important piece that's missing. There's also, I think as we think about some of the creative solutions that have been created in jurisdictions out there, that sometimes we have to think about, what projects that are catalysts for other projects, right? And so I think piloting innovative ideas, more piloting of innovative ideas, and also, thinking about how to really engage the public or the private sector much more heavily than we have in the past. I think that as we have the tech industry in the Bay Area, it's vital that they participate in the affordable housing discussion. We know that there are, organizations that many tech companies have created that have participated, but I think a deeper level of commitment to housing would help all parties, including some of those companies themselves. And so, we definitely are looking for companies that have this. I see in the chat someone said corporate social responsibility. Yeah, this idea that one's responsibility to their company also extends to the broader community. And so as a land trust that, works closely with the land and with residents, hopeful that there are opportunities to talk about how that partnership may work.
That's hard to add to. That was a really good response, but I'll say it's definitely public-private partnership. It's definitely coordination and collaboration. And if I'm in a safe space, I'll say we're missing from the table proportionally. That's what the problem is. I think that a lot of times, it's a lot of good-natured, good-hearted people that just don't look like us telling us what's good for us. And I would say that we know what's best for us. We know how to solve our own issues. And what we need is more peer feedback. We need more feedback loops that actually touch base with the community, trust the community, and let the community lead.
Yep. Agreed.
That's an interesting point, but sort of even back just a little bit to the private-public partnership, right? And we see a lot of nonprofits that are doing a lot of this heavy work, and where we're seeing a lot of the private companies have the capital, right? And what that marriage could actually look like. And I've heard arguments about the government needs to do more and subsidize more housing, or these corporations that are making everyone move to their city where they're headquartered or wherever their offices should be doing something about, if you're going to have all the people with the $200,000 salaries come in and take the housing, then you probably should be doing something to take care of the people that you're displacing. I've also heard it's in the people's hands. If you're homeless, you need to dig yourself out and pull yourself up by the bootstraps. So like when we're thinking about like who is responsible, it's almost like, I work in healthcare, right? And in healthcare, a lot of that conversation is the doctor responsible for keeping the patient healthy? Is the patient responsible for keeping themselves healthy? Is the insurance company responsible for keeping the patient healthy? Or is the hospital responsible for keeping the patient healthy, right? And I'm seeing those parallels when it comes to housing as well. And there's no coincidence given that the correlation between housing security and healthcare outcomes, right? But I would love to hear one of your perspectives on that, like who owns this, right? And maybe that's a part of the bigger problem where it's hard to solve something when there's no ownership. And what is your take on that?
Yeah, Logan, do you want to go? Or?
Yeah, I mean, that's a really good question, because I mean, I would say the answer is all of us. And it should be equitably distributed between who has the most resources. It's like really just reverse engineering from whatever we see the roots are, and seeing that we know what's causing this. We know that it's the high rents. And every single time that someone develops new housing, new luxury housing, there better be a ratio that keeps other people in mind. And I think that's really just part of sometimes the RFP process, the procurement process, the supply chain process, all these different processes where every single time that these contracts are being signed, and this goes back to the corporate responsibility comment, right? It's like when we're talking about these new developments, and sometimes the way we think about developments, right, is we know that there's a lot of investors that get behind these developments. We know that their business plan incorporates how much money they're going to make on their investment with rents, right? When someone has affordable housing, we know that those rents aren't going to be as high and can't contribute back to investors' pockets, right? We understand this, but we still have a responsibility, and we honestly need to put legislature in place when needed to ensure that this is going to happen. Because if we face the facts, we live in a capitalistic society. Capitalism is all amongst us, right? And the only way, and it's not about altruism, the only way to really just say, okay, knowing that we live in this capitalistic society, what do we do? Is we have to put boundaries into effect. Because otherwise they're going to get every penny out of us and hurt the people that have the least nonstop. So we have to understand what's happening and put boundaries in place to make it stop.
Yeah, I think in terms of responsibility, being a community-driven organization, and I think Logan and I share this, that the from the bottom up, I personally, it resonates with me that, it's, you have your people, you have yourself, you have your people, and it's, it's your duty to, try to fend for yourself, while also, I think, critiquing larger systems that, don't allow for a fair or equal playing field. And so, I think COVID in many ways, made it very difficult to organize and to, get together with individuals and to strategize about how to best work together. And Zoom is, not the same as sharing a meal with someone. And so thankfully, as we've started to come out of the heights of COVID, we've been able to create community and meet in person and really build that. I think also just thinking strategically about the system that we have and the realities of that. As Logan said, the need for public-private partnership, I think in the housing development world in which we sit, impact investors who are interested in a below market rate return on their investment, either debt or equity for projects, I think is a much needed tool. We need partnerships with hospitals and their community benefits departments, or if they have foundations, also looking at program related investments from them. We need inclusionary housing ordinances from local jurisdictions to ensure that those developments have a portion set aside for affordable units. We need higher reimbursement rates from the state of California as it relates to boarding care homes, and realizing that the SSI rate is barely enough for most operators to sustain themselves and to actually function to provide this much needed service that is often a direct pipeline to homelessness. We need a lot more support for families and families that provide support to their loved ones and don't have the resources to do it on their own. And so I think, as alluded to, it's a multifaceted issue that requires us to, think with a collective impact framework and really bring multiple parties to the table. I think the move towards social determinants of health has, in the medical space and in the housing space even, I think has been a huge improvement to say it's not just housing, it's not just community, it's a combination, it's all of these factors. And we know that we're pretty certain now that it is all of these other factors that we're able to help individuals improve their quality of life, which is ultimately what this is about, right? Like housing and homelessness is not just about units and someone living somewhere that they're miserable and still feel isolated and they're just not on the street and visible to us anymore. That's not really what this is about. It's really about like individuals thriving and living with vitality, and I think that comes from a coordinated and collective approach.
You both made amazing points, and more resources are needed, right? And that's something that is a reality that we all need to be just very honest about, and especially those that do have the resources, right? More resources are needed. We can't, we are, organizations like both of yours have done a great job of, maximizing with the resources you do have, and that doesn't mean the most. But you mentioned healthcare, you mentioned social determinants of health, and I related and I empathize because a vast majority of I work for a value-based care organization where we are a full risk model specifically for Medicare patients that are 65 up, and typically your sickest of the sickest, or those that have a lot of health outcomes that are directly impacted by their social status. Many of my patients are housing insecure. And a lot of the points that I bring to the table at our leadership table is, look, we're not going to be able to get patients to refill their medications if they don't have a place that they know where they're going to sleep tonight. Mm-hmm. And they have to be at the shelter at 2:00 and get in line. Otherwise, they're not going to be able to sleep anywhere tonight except on the street. they're not going to be able to make their appointment at 3 o'clock, and those are a lot of the conversations that we're having, because even though as a healthcare organization, we really want to see health outcomes improve, we have to address the, what is it, the hierarchy of needs, right? If you don't have your foundational basal needs, how in the world are you worried about the very top, right? So do you guys have a thought on how the healthcare met? You guys have seen the commitment that Kaiser based in Oakland has been making, and we've seen it on LinkedIn. Folks that aren't in California have probably seen the promises, the commitments, the pledges, but you guys are there in Oakland and seeing like what exactly can be done from a health system or from a healthcare organization to support this entire initiative. Where do you see healthcare playing a role? Or maybe it's a bunch of different ways. Maybe it's, in the preventative space, maybe it's in the post space, and maybe it's in the intra homelessness space, right? But how can you see healthcare organizations and healthcare leaders doing a better job of taking a step forward and partnering with organizations and folks like you guys?
Yeah, I think that, there are, one way to look at it is that there are, what are the existing cost and benefits for hospitals related to this population? If it's a purely economic, perspective, saying that there are individuals that are high cost users of medical care, and if we provide housing, there would be less reliance on medical services, and also improvement of symptoms if individuals live in safe and secure housing. I think that that is just being self-interested and wanting to participate for one's own benefit, which I think is totally fine, and would do a lot to help improve the situation. I also think that like Kaiser Foundation and many others across the county, there have been many partnerships between health organizations and even land trust and housing organizations, that the importance of creating acquisition funds so that community land trusts and nonprofit developers can quickly take properties off of the speculative market is a huge piece. I think that there are investments like social impact bonds that have been used to catalyze neighborhoods. Denver specifically has used this to address homelessness in the city, and thinking about some of the cost savings and pairing that to housing stability for residents, and if private investors who provide the upfront capital, which could be hospitals and other private investors, if we reduce the cost of those individuals, the investors being compensated for that success. So I think that there are some ways. I think the health tech partnership, I think, is another one. We kind of have these investments being made in isolation. I think really collaborative of a consortium of hospitals and tech leaders is also a recommendation, something that I would put out there.
Again, hard to follow that. It's just too good. It's just too good. But I'll say that, as we've already noted, health and housing and equity, all those things are really inextricably connected, right? And that's why when we were talking about where we wanted to sub-grant, what neighborhoods we wanted to focus on, part of that was focusing on the neighborhoods that had the worst health outcomes. And that's a very clear proxy for everything else, right? That's where the food deserts are. That's where everything is happening. That's where a lot of the environmental issues are happening, right? So it's like, those are our proxies. That's where we focus. And in 2015, and this is a quick sidebar, in 2015, there's an organization called Destination Home based out of Santa Clara County, our neighboring county. They found that the cost of homelessness per person was $83,000 a year on taxpayers. $83,000 a year, based on how many times they utilize the emergency room instead of actually getting proactive treatment, based on how many times they interact with the criminal justice system, based on how many times, you know, a fire truck and an ambulance get called instead of just kind of going to a doctor's appointment. So all of the luxuries that we have in housing, when someone doesn't have housing or is in a precarious situation, if we don't invest in it on the front end, we're going to pay for it on the back end exponentially. And that $83,000 since 2015, if we talk about an 11% interest, that's about $92,000 a day. So basically, these are the things we have to talk about. And that's, again, this is what's being happened when we utilize emergency services that healthcare offers instead of the proactive services that we really need to invest in. So this is really an exchange that we need to have often.
You know, I almost thought you were doing a shameless plug to value-based health here, because that was but you know, but that's how that partnership is created, right? When you're so focused on, you know, prevention and education and doing the things up front, you don't have to worry about the things on the back end, right? And that's the beauty of what this could look like if all the parties and stakeholders came together and just sat at the table and had this conversation. And we're having some amazing comments that are coming in. So I'm just going to read a few of these before I ask you guys just one last question and open up for Q&A. But you know, we're hearing comments from Christina. And thank you, Christina. Keep them coming. We need to investigate all available housing during the homeless crisis. Then they should be fine, and that money can be used as a contingency management fund account, which is really interesting. We have a lot of ideas, grassroots in the community. Let's make social determinants of health profitable. But we're going to mix the market if we try to do that, right? If we try to tie money to it, right? But we need more peer respite options. What about the homeless patients that go in the hospital and need surgery, but they don't have anywhere to rehab? A lot of these things that are all tied in together with patients' health is really tied into their ability to live happy lives, as Tevin was point earlier. But my last question for you all, you know, I am extremely passionate about this subject. There are thousands of people that are extremely passionate about this subject, but just simply don't know where to actually start when it comes to addressing, you know, unless you're a housing investor and you're just ready to drop money on a building itself. It's really hard to get in there and feel like you're making an impact immediately. Do you guys have any advice or thoughts on, like, if someone really wants to go in and make a difference, point them in the right direction? What could they do, or where could they go?
Well, to start, I'll say, if you're in Oakland, go to keepoaklandhouse.org. But anywhere else, it's really just finding those gaps in the community, and being active in your city council, being active at the county supervisor or administrator meetings, and advocating, right? And I think it's really helpful that you put, you know, these forums together, because there's so many interventions that we don't even know what's available or what other municipalities are trying. So if you're in a community where you know that evictions are happening rapidly, you know, and they're running rampant and people are just losing their housing, go to your city council and talk about the prevention work that we're doing in places like Oakland, a whole bunch of other places. Quick shout out to my man, Eugene Canson. That's a health policy guy. You're gonna want him on your next one. Yeah, that's a health policy guy in the space of homelessness. But in general, I have to tell you, it's like, just be active in your local politics, and just know what the interventions are and advocate for them.
Yeah, all great recommendations. And yeah, I think housing is a large issue. So it's kind of different approaches to attack it. You know, I think at some level there's the policy wonks and, like, you know, trying to get in on that end. And then on the other end of it, it's like, you know, what is your personal circumstances? What are the circumstances of your neighbors? Are there houseless individuals in your neighborhood? And how do you, you know, work to, you know, make that better? I think as a community-driven organization, my response is often, connecting to individuals who are not doing well in your community and organizations that are supporting them. I think that many times that means having a conversation with someone who's houseless living in our community, or visiting an adult residential facility that, and volunteering your time to, paint a room or plant trees. I really do think there's an opportunity to, to dig into to both sides of the issue. I think, the urban displacement project at UC Berkeley and all of the great resources that we have here in the Bay Area with Stanford and UC Berkeley and Cal State East Bay and San Francisco State University. There's a huge amount of, really smart people around us that we can call upon to try to figure out what's going on with housing and how to best address it. But that other piece that I think has been mentioned in the chat and is, city council, local government, going to board of supervisors meetings, participating in the housing element, at the county and city levels, really trying to ensure that the best policy is included in policy documents and that have long-lasting effects. And so showing up to particular projects, learning, speaking to developers of projects and asking them about, the diversity on their teams and the affordability of the project and who they're really trying to serve. And so, I have, my contact information as well, if I can be a resource to anyone to plug into this issue of housing, because I do think it is, it's important for us, in many ways to have a grasp of the the complexity of the issues, and also have people that we can talk to about it to figure out next steps.
Wow. I think that is awesome. There's so many different ways that you can just get in, right? Whether it's get involved locally, get involved with your neighbors, get involved with policy, government, or whether it's just, just so many options because it's so broad to just get in and just get something going and just start helping. But, you guys have set a precedent and shown us that it is possible to get in there, get your hands dirty, and really do make great impact here. We have a couple questions, and I wanted to just open up for if anyone had some questions. We do have one, and good sir, please forgive me if I am not pronouncing your name correctly. I'm gonna give it a shot. Ibukun asked, what are you guys' thoughts on large corporations buying up all of the single family homes?
Well, I'll just plug in a little bit. There's, this happened, and I don't know specifically what investor you might be talking about. This might be Blackstone or some other, I probably shouldn't say specific names, I don't know. But I think that generally there's always these waves, right? There's economic pain and strain for a certain group of individuals, and what are termed vultures, I guess, start swarming around and figure out that it's an opportunity to purchase a property. My personal view is that we should also be creating similar funds for socially responsible acquisitions. And so, although that activity is happening, I think policy is often, it takes a very long time. And sometimes takes even more time to correct and fix. And so, those of us in the community who have resources or access to resources, creating opportunities for similar funds that also maintain long-term affordability, I feel is my take.
Yeah, again, I love that response. The only thing I could really think to add would be, I hate it. It shouldn't be happening. And I mean, the truth of the matter is, we need to stop letting these corporations Trojan horse their way into our community. And they tease us with, having all these jobs coming in. It's going to get so many more people employed. They talk about how much tax money it's going to bring to the city. And, they talk to us about this, and then our council members, they give us the thumbs up, and we just appreciate them for that. But then we see what the byproduct looks like. We see what happens. So the second somebody comes to your community selling a dream, talking about how they're bringing jobs and more tax revenue to the city, you say, all right, hold it. You know what I'm saying? What does this mean? And really hold your representative accountable, man. Educate the community and don't let them pull the wool over our eyes.
Man, I'm kind of motivated. I was a little tired at the beginning of this conversation, and now I feel like I'm ready to jump right in and fix housing right now. But no, that is amazing. We have another question, Linda Allen. How can we regenerate our communities? As you suggested using a collective impact framework, but how do we bring this juice back to the communities that may have had that exact same, hey, they came in, made this promise, broke our hearts and left. And now here we are. But how do we bring that energy and that life back?
Bringing the life back maybe you can give me a little more context.
No, absolutely. Or Linda, would you be willing to probably come off mute and clarify?
I guess that was a pretty broad question. I had written down as y'all were speaking, this notion that Teslam had raised early on about using a collective impact framework. And as the discussion has gone along, I asked myself some questions. One was, first of all, how can we nourish our communities, our neighborhoods, in a way that helps to create an atmosphere of broader community, a sense of us, rather than the individualistic paradigm that our society has brought us to. So, because I think that all of the ideas that are generated today and all of the issues that have been raised really have to be looked at from a more integrated, while at the same time broadest possible perspective. All actions have consequences. Some of them are unanticipated, unknown. And how can we learn from that and move forward? And how can we generate an atmosphere in our communities where we don't have to deal with these questions that are raised today with the feeling of, I don't want to say, with the feeling that we don't have all the right ingredients. We do have all the right ingredients. I think it's just how we tell our story. And I think that there are property owners out there who we will find want to help to contribute to finding permanent, long-term community building solutions.
Yeah. Well, great. Thank you so much for that context, Linda. I think that the importance of gatherings like this, the importance of an invitation is so important. We do have more and more conversations about housing now. I think that, the collective impact pieces, as we start gathering and start realizing that we have shared goals and visions, that there are shared outcomes of our work and our activity, and kind of coming to that. If you think about a healthcare provider, a housing provider, a community organization, families, residents, the number of different groups, that there are important pieces of the work that mean something to all, they all share, shared goals and values. And it takes some time to get to that shared piece. But when you have a disparate group of organizations and individuals participating in work and realize that there are a set of set outcomes that they all share, I think it does make the work much easier. It makes it easier to identify how well you're doing. It makes it easier to figure out what resources are needed, and you probably have the answers, I think, as you alluded to, at the table, that there is an ability to pull on individuals in the community, and starting with tools like asset mapping and seeing just where are the core pieces that are needed for a successful project or to revamp or change a system.
Well, we got two more. I saw Sierra. Thank you, Tezin. That was a great answer. Thank you for your question. That was a great question. It was really insightful. We have two more, and I know before we run up, I want to get to these, at least these last two questions. Sierra, I saw your hand come up. Did you have a question that you wanted to ask?
Yes, I figured it'd be better than trying to type it. So I am Sierra. I'm a part of the healthcare administration, got my master's in health administration, but I also practice as a realtor. So I've been a realtor for about 3 or 4 years now. So this is like really exciting to me. And I'm in the Metro Detroit area, and you kind of alluded to some of the things that I can get involved in, but my question is, in what capacity or in what ways have you partnered with realtors in the past? What role can a realtor play in this space? Like I mentioned, I'm from the Metro Detroit area, and it's rough sometimes on me trying to help millennials, especially people I grew up with, that are getting their career started, trying to find housing, whether it's a nice rental that isn't from the 1970s that costs over $2,000, or finding a house that's reasonable that they can afford the down payment and closing costs on. So just kind of curious what your thoughts are on how a realtor can play a role in this space.
Logan, do you want to go, or?
Yeah, sure. So I'll say this. We've partnered with realtors in the past, not just on the funding side, because when we talk about homelessness prevention, we're not only talking about keeping tenants in their place, we're also talking about making landlords whole again. But then the other side of it is, for example, one thing that we think about is displacement as a whole. And I think about how the same way we want to help with, right now we're talking about helping with deposits, first month's rent, last month's rent. But what I would like to really evolve into would be helping people with mortgage deposits, and stuff like that, so people can actually get into owning land. So really, I think that's where there's alignment. That's where there's this common goal that I think my work and a realtor's work would come to, where there are ways where we could think about different models, different sources of funding, and different ways to actually make it so we focus on ownership for the people that are having trouble getting in, because nothing is better than actually having someone that grew up in a community being able to buy in their community. So I really do think, in general, if I had to give you like something more specific, something more solid, I would just say really those models exist, and the collaborations don't always exist. So really just finding ways to collaborate, kind of like bridge that gap in the aisle, and actually partnering to push these initiatives.
Yeah, and I think I would add that when we're working to acquire a property, we're working, there's not like a special nonprofit discount or anything, you know. And so we have to go to real estate agents and brokers to, you know, negotiate these deals. It's often helpful if there's a property that's off the market and you know about that, and you know that, you know, maybe there's an affordable housing or a permanent supportive housing provider, developer who has access to capital or could in a short period of time based on working with a patient seller. You know, we're finding that there's often there are a number of owners, property owners across Alameda County that realize that we are in this high cost market and that things are out of whack, and they want to play some role in changing that, you know, either donating a property at the end of their life or working with a community land trust to reduce the purchase price, you know, donating a portion of the property in the acquisition. And so, you know, I think having some of that expertise and being able to provide that to property owners to say, you know, thinking about legacy, some of this is like, you know, relates to individuals' long-term property owners, long-term goals. And I think that there's a way to use ownership of property, you know, in line with, you know, a legacy that someone is interested in maintaining and providing this public benefit.
Amazing, great answers. And you know, hopefully that answered your question. I know, you know, we've had a nice long conversation. Christina, I know I saw your last question. I think I'll end with this, and then we'll pass it back off to Andrea to kind of wrap up and tie this nice, beautiful bow on this amazing conversation. Christina, you mentioned, what about employment connection? Would you mind kind of clarifying your question, and we can kind of end with you should actually.
Okay, thank you. Just real quick, I was saying like how you guys and thank you for the time. How we were already mentioning about collaborating with like the home property associations and like collaborating with them to see, like the lady that was just speaking, like she's a realtor. What could she do? Well, she could talk to her other realtor friends and say, hey, I remember that you have those 5 homes, they're empty and you're not doing anything, and you know, you're getting older and you don't want all this property. How about you donate to help with a housing solution, that it'll be a forever solution for housing. I just put in the chat, maybe we need to reach out to Sugar T, to Mr. Fab, and have them reach out to Snoop Dogg and Beyonce and all their friends, because there's some rappers that's buying up blocks to house the people that live there. So like maybe we need to reach out to the people that already got a lot of money and ask them, hey, can you help us get this property? This is why we're doing it. And so Jay-Z, Beyonce, Snoop, Sugar T, and Mr. Fab, they're all for the community. But reach out to them. So that was my question. That's my piece. Okay,
I like where you're going with it, man. Let's do it. Let's do it.
It's all about collaboration at the end of the day, right? And when those that, and it's a good point, right? You know, those that have the capital that we know share the exact same values and passions for this work that we do, why not tap it? Why not tap those resources? Why not shoot the shot and do what we got to do for the folks that, you know, are really desperately do need some help here in these communities, and for the organizations that are desperately have their boots on the ground and are doing the dirty work themselves with just, you know, hey, just slide us a couple dollars, we'll take care of the rest. But thank you all, Teslim, Logan, thank you. This was an absolutely amazing conversation. Told you I'm juiced, I'm excited. I do want to pass the ball back off to Andrea. She is here to kind of add some tying notes and talk about what we have going forward in our next forum.
Yes, thank you. And thank you again, Teslim, Logan, Josh, wonderful conversation. I can see just by the chat, you know, how exciting and engaged, you know, our group really is. Oops, there we go. But just to close the loop here, you know, if this was something as our audience members that you were interested in, if you want to, you know, continue to have the conversation, to get involved with the Advancement League, please do either put your name in the chat, contact information, or we'll send out this video also at a later date so you can rewatch it, share with your friends, your colleagues, anyone of interest. But please do get involved. So as I mentioned before at the start of the call, this will be a quarterly forum. And so our next discussion will be, don't have a firm date yet, but next quarter, we're focused on mental health and happiness. So again, if you're something you're interested in, if you have ideas, please let us know. Just thank you all again. This was really, really exciting, I think, to hear. And so looking forward to seeing you all next time. Thank you.
Great. Thanks so much.
Thank you all. Have an amazing night. Thank you again, Logan and Tezin.
Thanks. Take care. Bye.